Hello. Welcome to Aging Well in America. I'm Anne Marie Gattari, your host. Today we have with us a very special guest, Diane Sasson from Sasson Senior Services. Diane is a care manager. Welcome, Diane. Thank you for joining us today.
Thank you, Anne Marie, for inviting me.
You're so very welcome. What is care management?
Care management answers the question of, well, what should I do about my mother? Does she need to move or can she stay? It answers the question of, I live in California and my father lives in Michigan, and what do you think he needs to do to improve his life? It answers the question of, my mother's refusing to move and living in a house that's cluttered. How can you help me?
Wonderful. So that's great. It helps answer those questions. I get calls all the time from people who are saying, I need help. I don't know what that help looks like or what it is. So if they were to call Sasson Senior Services, take us through kind of the steps of how you work with a family.
Okay, the first step is always an assessment. People think that maybe their mother's falling apart, and actually she's pretty okay and it might be something physical. So the assessment includes not only how she's doing at home and emotionally, but what's going on physically. Sometimes people aren't eating properly, and then it masks itself as confusion and dementia.
And you call in other resources. Do you work with their doctors and pharmacists and so forth?
Doctors, pharmacists, home care agencies, local community resources that will come in the home. And once the assessment phase is finished, then we can figure out a plan of what would help the person improve their life.
Okay. Can you give us an anecdotal story? Somebody, tell us, obviously without names, but give us a story of somebody you have actually helped and what exactly you've done from kind of A to Z, if you will.
Okay, well, right now I have a gentleman who fell in his apartment, and his daughter lives in California, and she had hired me previous to the fall, which was good, so he and I already knew one another.
Okay.
And he ended up at Providence Hospital, and he was treated for the fall, but it also looked like he had other problems as well, and he's in the psych unit right now at Providence.
Okay.
And where we go from there is he really can't return to where he was living. So
he was living alone?
Yeah, in independent senior housing, but he needs more.
Okay.
So I'm looking for either a group home, adult foster home, some kind of assisted living facility where he can move to post-hospitalization.
Okay.
Other cases, there is a woman I've been working with, and her family is right here, but she was really wearing them down, and she had a lot of doctor's appointments and dental appointments, and I was taking her to all the appointments and then communicating with her family, and they were so happy to be relieved of that responsibility.
Okay, so you actually do some of the tasks.
Hands-on.
The hands-on, okay.
Yeah, I call myself the professional daughter, or the family in absentia, because if your family's not around, everybody needs a daughter, and a professional daughter is even better.
Absolutely, yeah. Our parents tend to argue less with the professionals. Right?
Yeah. And people tend to take the word of somebody who comes in from the outside rather than their own family.
Yeah,
what does he know?
What is that?
Yeah, I knew my son all his life. How could he tell me what to do? Or Uncle Joe, he was always an idiot. I'm not going to listen to him. But when you come in the home with a badge on and you have some paperwork, it makes you look professional, besides the fact that I have the background and people are more likely to listen.
Sure. Tell us about your background, Diane. You certainly do have the education and credentials.
Right. I have a bachelor's degree from University of Michigan. We're all Michigan fans. And I have a master's degree in Health and Human Service Administration. And
your bachelor's is in social work.
Correct.
Okay.
And that's enabled me to do so many different things. I worked with geriatric population way back in the 80s, and people used to say, I think my husband has Alzheimer's disease, because that's before we all knew what Alzheimer's disease was.
Yeah.
So I started in aging 20, 30 years ago.
Oh, my.
And then I worked in home care, similar to Anne Marie. And then doing care management is just a logical progression of the same career.
Okay. So care management, again, you're actually managing the person's day-to-day lives until, or maybe even after they get settled in a place where the adult children feel that they are safe and can go on.
Right. No one wants to be alone. So a wonderful service that my company offers is 24/7 on call. And either myself or one of my staff will always be available. Nobody falls in their house at 2 p.m. on a Tuesday afternoon. Everybody falls at midnight or on a Saturday or Sunday. And then either I or one of my staff meet the person at the hospital. We have the medical record with us and a list of the medications and family members. And everyone in a hospital needs an advocate. You need someone to hold your hand for support, but you also need someone to speak up with the nurses and doctors. Now, what's going on here?
Yeah. How do people start how do they initiate contact with you and start the process?
Or how do they find me?
Yeah.
Yeah. I get a lot of referrals from elder law attorneys, often from financial planners, because if you're going to talk about your money, you talk about other things that are happening in your life as well. From home care agencies, from housing, and a lot of word of mouth. You know, my neighbor needs help, and I know you do that. Well, how could you help her? And then I speak with people on the phone, or we speak by email. Sometimes it's people really at a distance. It could be in another country, and the email is wonderful. Or texting, and that starts the process.
The plan that you write after the initial assessment, what does it look like?
It's called the care plan, and it looks like the problem someone's having, like going upstairs, say, is a problem. And then a possible solution or activity would be put in a ramp, put in a chairlift, or maybe move someplace without stairs.
Do you have, you mentioned your staff. Who comprises your staff? Other social workers, nurses?
Both. Social workers, I have a physician's assistant, a nurse. Often it's really good to have medical eyes come in as well as social work eyes.
Yes, yeah. So they'll go in and is that automatically part of the services is a clinical assessment, or that's only?
It depends. Each case is so different.
Sure.
And sometimes people are really well organized on the medical part, or there's another agency involved. But sometimes my nurse will set up their medications, take their blood pressure, oversee what's going on every week.
Yeah, I know it's not uncommon for our elderly loved ones to kind of be assessed, overly assessed, right? They might have a Medicare agency that's come in and done an assessment. They might have a home care agency that's come in and done an assessment, and then a care manager. So sometimes they may be feeling like, you know, we've answered these questions once or twice.
And they say that to me. Why are you asking me all these questions? And then I usually turn it around and say, you're right, it's too many questions. Ask me something. It's like, well, who sent you here? Why are you here? Why are you sitting in my kitchen?
Do you often go when family members, or do you see the elderly loved one on your own?
It depends. Sometimes the family members are 1,000 miles away. I like to meet with the family first, or sometimes I meet with one spouse before I meet with the other spouse. Often, fortunately, just one person in the couple is confused at a time. So it's often easier to meet with the less confused person and then meet with the person with dementia as well.
Yeah, I understand. Diane, you said you've been doing this for almost 30 years.
Right.
How, in the elder care industry, if you will.
Right.
Tell us how you were drawn to this field.
Years ago, I worked for a program under Title III that was federal funding, but those monies are long dried up. And we visited older adults in their own communities to provide health screening. And I worked on a special geriatric unit. We lived in Minneapolis.
Okay.
I've worked in home care since the industry was pretty new, and then went on to care management. And I've been in care management now about 17 years. And it kind of draws on everything else I've done, so that's really nice.
Yeah, that is wonderful. Now, your area, that the geographic area that you work in, is pretty much all of southeastern Michigan?
Right, well, the Tri-County area.
Okay.
I'll go to Wayne, Oakland, and Macomb County.
Okay.
And then if I get a call in Washtenaw County, I have a counterpart there, and sometimes we work together.
Okay, so you refer a lot of people. So we've talked about the elderly quite a bit, but you have another side to your business, which is helping mental health patients. They may be elderly, they may not. Talk to us a little bit about that. That's a little,
There's
little more
there's a real
challenging.
demand for people to work with people with mental health problems. Actually, there's a lot more resources of where an older adult can move than somebody who's 50 years old and has mental health problems. They don't want to live in a residence where everybody has a walker and having the kind of problems elderly do. They have a different set of problems. As you said, very challenging population, and there's not a whole lot of resources available. So I assist them in finding the best resource that would apply to their situation. And a lot of times it has to do with financial resources, what the family and the person can afford. Often depends on where they're eligible to move.
Now, if they're living at home in their own individual residences,
then we can bring in people like yourselves to help them out, especially people who are trained to work with mental health patients.
Sure.
Have some experience, because it is different than working with elderly.
Yes, it is to a degree. I think we're finding more and more of our caregivers, our professional caregiver population, are getting some of this training in various group homes or other facilities that they may have worked in as well.
That's true, but unfortunately, not so many people are trained in mental health.
Yeah. What kind of training is required, in your opinion?
Well, it's really nice if they get some specialized training, even if they took classes at a community college, or they've worked with mental health people in a hospital setting. Some people kind of are born naturals, and they seem to just have that ability to be relaxed and know what to say. But others really need the training.
Sure, of course. What would you say to a family member who has a family member who is having some difficulty with mental health issues, and maybe you mentioned earlier when we were speaking before we started that a lot of people are coming home because the facilities are not
closed.
There. Yeah. So walk us through that process. Is it very different, and how do you help a family in that predicament?
Yeah, well, no one should be alone. That's the hardest thing if someone has mental health problems and they live alone in their own home or in their own apartment, because really their safety is at risk. I always worry that they might hurt themselves or hurt someone else. So it's always better to have other people around, whether it's caregivers coming in every day, whether you live in a group home with other people. Diversity is sometimes a big issue. People want to live where there's other people who are like themselves. That's just natural for all of us. I try to link people up with the resources they need, whether it's a good psychiatrist who totally understands. More and more people are seeking alternative therapy. There's alternative psychiatrists around now who do different kinds of body work. There's different pharmacies around, whether it's a compounding pharmacy or a traditional pharmacy. There's volunteers in all of the communities. There's sometimes an activity center where people with mental health problems can go every day.
Oh, my.
Often transportation is a big issue, but there is transportation available in different communities. There's a lot of resources, but it's unrealistic to think that the person or the family can find all of that themselves.
Yes, yes, the ones you've named, many of them I'm familiar with, but many I don't think of, especially the volunteer aspect. If somebody needs some companionship,
Right.
and they cannot afford to pay for it out of pocket, and their insurance is not going to cover it because, as we know, health insurance and Medicare do not pay for attendant care.
Right.
What kind of volunteer resources do we have in the community?
Yeah, it really depends which community. Some communities have a lot more resources than others. Sometimes the churches will send someone out. I think we overlook the churches sometimes. And I'll call there and speak with someone and ask them what kind of volunteer network they have for visiting someone.
Yes, that's a great idea. Or transporting,
Right.
taking them to appointments.
Yeah. Transporting, sometimes people are worried about the liability of putting someone in their car. Other times they're not. But there are agencies around that will provide transportation and different communities.
Sure. The community centers often also have a lot of, they're a nice resource because they're a place where people can go, get out of their four walls, and take part in an activity. I guess I'm jumping now back to the senior side of things because we have so many wonderful senior citizen community centers. Right here in the Grosse Pointes, we have services for older citizens, which serves, of course, the Grosse Pointes and Harper Woods. And then every city has its own center where the list of activities is really endless. How closely do you work with some of those centers, and what's your company's role?
Yeah, often I'll help someone get to one of the senior centers. Sometimes a person can't really manage to go by themselves, and then I need a private duty home care agency to have a staff person to go with them into the center and kind of steer them. If someone's confused, you can get them to the front door, but you can't get them too much further than that. You really need someone to go right along with you.
Right. And I'm assuming you have found, as I have, that going to these classes on a regular basis is really, really quite beneficial.
Oh,
Even
yeah.
people who think that their mother or father is really antisocial and not interested in doing much of those activities, playing cards or some type of a chair exercise, or just going and listening to somebody play the piano and sing.
Right, and once they get there, they really do enjoy it. And they speak with the person sitting next to them. It's all convincing them to get there.
Yeah. Tell me, on your best day, what does it feel like to be doing your work?
Oh, it's really satisfying at the end of the day to look in the mirror and think, oh, I really improved someone's life today. Hopefully it'll last till tomorrow, but today he was really happy, or she was really happy.
Yeah.
It's a good feeling.
Yeah. Where do you see this going, Diane? So many, the elderly population is just going to continue to grow as we baby boomers age. We already know the stats, 5.5 million people today from the 2010 census are over 85. And by 2050, which, isn't all that long, it sounds like a long time, but really it's not, 20 million people will be over 85.
Right, and they're just going to need more and more assistance and more resources. Now the housing, usually people often don't enter older adult housing until into their 90s, whereas the housing was built for people entering in their 70s. But people in their 70s are often still working, very active in the community.
And they want to stay in their own homes, right?
Right, so there's all kinds of home modifications. There's communities around where you can go in when you're pretty healthy and mobile, and you can stay there the rest of your life.
And kind of move to the appropriate
Right.
area of the community,
Right.
As
Which is
your
really
needs
nice.
change. Yes, that's really some nice forethought that's gone into that. What else? We've got about 5 minutes left. What else do you think our viewers should know about care management and about your company?
Yeah, well, I think
specifically?
finances are a big thing. If you're watching this program and you're able to get long-term care insurance, because there's many different ways now to get long-term care insurance, that's a wonderful program. My clients who have long-term care, it really takes some of the financial burden off of their shoulders, and they're able to do so much more. If you don't have that, I'm seeing more and more families chipping in and paying. It's there's 5 children in the family, and mom and dad are running out of money. The family will help out for what the person needs.
Yes, I've seen that a lot too. It's very nice to see that.
Yeah, so my services are not paid for by Medicare or Medicaid, but I do accept insurance plans like automobile insurance if there's an accident, long-term care insurance. I will read the policy and help them submit any claims. So we work with the family to figure that out, the financial end.
Excellent. And the other payment source is, of course, VA benefits.
Right.
And,
the VA benefits go a long way. That's been wonderful.
Yes. Do you work with, do you have a source for somebody who needs to apply for their benefits?
Right. I often use an elder law attorney, or I call the VA directly myself.
Okay. So
what I found is that people lose all their records.
Yes.
It's they can't find their discharge papers, and they need someone like myself to make the calls and organize all the records.
Yeah, my father, that was exactly his situation, and we spent a lot of hours on the phone, but he's now gone, but he had 4 adult daughters in the area.
Right.
So a lot of families don't have that. They're not able to count on family like that.
No, and it's unfair for older adults to have to manage the phone systems now. Dial 3 for this and 7 for this, and then please be patient and wait, and then they wait and wait, and then dial 10, and usually the person just hangs up.
Yeah,
But
exactly.
That's it. It's too much.
Or they're trying to do it while they're at
Right.
work, right? Or taking care of their own children at home.
Right.
I realized when I was in the throes of this with my parents that we weren't trained to take care of our parents
Right.
as though they are our children.
Right.
And that's what so many of us in our 50s and 60s find ourselves in that situation. We are now taking care of our parents as though they are our children.
Right.
And forget the physical and the logical stress, just the day-to-day, but the emotional when you take a moment and really think about what that means.
Becoming your parent's parent, that's really, really tough.
It is, and someone like you can help a lot.
Right, they need you and me in that instance.
Yeah.
I tell people, just be the daughter, just be the son. Let me be the professional and figure things out and take them here or there. You don't have to do that.
Yeah. I imagine you get calls from the daughters and sons and the grandchildren, and they just need really to kind of cry on your shoulder. I'm assuming your social work background gives you
a lot of venting, and that's good. Then you feel better.
Yeah.
And then, say, okay, then this is our plan. I'm taking your mother to the doctor. My nurse is going to come set up the medications. And they go, really?
Yeah.
Oh, that's such a relief.
Yeah, we won't have to I won't have to worry about which meetings I'm going to reschedule next week.
Right.
To do that. I remember I was at Ford Motor Company when my parents were elderly and starting to need a lot of care. And I would rush, from Dearborn to Clinton Township, take a long lunch, and one time my dad was in the car with me. I was taking him to a doctor's appointment, and he looks at me, and I'm going to use his French. He looks at me and he says, "We're really getting to be a pain in the ass, aren't we?" And I felt so bad, but you know what I did? I just drove faster.
Yeah.
As the adult daughter, now when I look back, I should have just rubbed his shoulder and said, "No, Dad, it's fine." But being in the throes of it, and I'm
it's
sure
so difficult.
our viewers can relate to that. When you're in the throes of it, you just need to get the task in front of you done. And someone like you, home care agency, care management, there's so many resources. The volunteers from the church, they can't help, and it is gratifying when families can call on us and feel that relief.
Right. These support groups are great for the family members.
Yes, they are.
Yeah, meet with other people in the same situation and see, how somebody else solving that problem. That's wonderful.
Yes, that's great. And I know you have a wonderful staff because I've met at least one of them. And again, it's not a matter of whether or not Diane herself is available. You've got
There's always someone, because I can only be one place at one time.
Sure. Okay. Diane, we've come to the end of our show, if you can believe it or not.
That was so fast. Thank you so much
if there's
for
anything
giving
else?
me time to talk about care management and Sasson Senior Services.
You're very welcome, and God bless you in the good work that you do.
Oh, thanks, and I'm always ready to answer any questions by phone or by email.
And we'll have your phone number, your website will be here on the screen as the credits roll.
Thanks.
So I'd like to thank you again for another opportunity to speak to you about one of the areas of life that I'm very passionate about, taking care of our aging loved ones. I'm Anne Marie Gattari. Please send us your ideas for future shows here at the Grosse Pointe War Memorial. Thank you, and we'll see you next time.